Today's guest is Ann Veneman, the Executive Director of UNICEF, the United Nations Children's Agency that helps children around the world survive and thrive by both protecting and advocating for their rights. Since becoming Executive Director 4 years ago, Ann has visited over 60 countries to review the plight of children and UNICEF's work to assist them. Prior to joining UNICEF, Ann was the first woman to serve as the Secretary of the U.S. Department of Agriculture under George W. Bush. She recently was named number 46 in the top 100 of the Forbes Most Powerful Women list. So Ann, welcome to Give and Take.
Thank you so much.
Now, you resigned as Secretary of Agriculture when Secretary General Kofi Annan appointed you as Executive Director of UNICEF in 2005. Why did you make that career move?
Well, I thought this was an opportunity that I didn't want to pass by. It was an opportunity to really go from I had done state public policy, national public policy, to really go to the international arena. And I have a background in both law and public policy, and I thought this was an opportunity that would probably only come around once in a lifetime. And I thought, this is something I think I'd like to take a chance and do, and I'm very glad I did.
But let's talk about some of the work that UNICEF is doing. What to you are really the top priorities of UNICEF, particularly in this very difficult economic recession?
Well, UNICEF deals with the health, education, and protection primarily of children, but also the health of the woman is so linked to the health of the child that we really deal with women and children's issues. So, for example, we recently announced that the under 5 mortality rate has come down even more, that in fact, since 1990, which is the base year for what we call the Millennium Development Goals, the number of child deaths has declined by 10,000 per day. And that's despite the fact that since 1990, the population of the world has gone up by more than 1 billion people.
Well, let's talk about that for a minute, because New York Times writer Nicholas Kristof recently wrote a piece that he felt that in economic recession, childhood deaths would actually increase. And he quoted a World Bank statistic that predicted that the economic crisis would cause an additional 22 children to die per hour, and that was the best case scenario. Why do you think that there is this conflicting data out there?
Well, I think that what's important to recognize is that some of that data would assume that the programs that are in place would not continue at the same rates. And yet, I think if we keep focus on what's working, why are the childhood deaths going down? They're going down because immunization rates have gone up so much. More children are getting vaccinated around the world than ever before today. So that's an important factor. More children are getting access to insecticide-treated bed nets. The world has had a huge scale-up in trying to help prevent malaria from transmitting to children, which is one of the big killers of childhood deaths. And I think we're seeing the impact of more insecticide-treated bed nets. Vitamin A supplementation is known to help prevent childhood deaths. Treatment for diarrheal diseases, treatment for basic childhood diseases has all increased around the world. And I think this is why we see the rates and the real numbers coming down in terms of child mortality. It's a success story about how, you know, simple interventions and development assistance can combine to really make a difference.
Well, let's talk about some of these childhood diseases, because I was surprised, and I think our audience will be surprised to know that 2 of the leading causes of death for children are pneumonia and diarrhea, clearly treatable conditions. Yes. What's going on in terms of why we're still seeing these kinds of numbers in terms of childhood mortality?
Well, pneumonia, of course, you know, prevalent around the world is really treatable if you have access to basic antibiotics. And so pneumonia really is a matter of getting antibiotics there for children who are impacted. But there are also promising vaccines coming on the market now that should help to prevent pneumonia. On diarrhea, the second biggest killer of children, it's very linked to lack of clean water around the world. And lack of proper sanitation. And so children often get diarrheal diseases because of lack of clean water. It's easily treatable with oral rehydration therapy. There's also a new rotavirus vaccine that's coming on the market now that will be available to help vaccinate children against diarrheal diseases, and that should be very helpful as well. We continue to see new vaccines, we continue to see new interventions and expanding interventions around the world, which has helped this child mortality rate come down over the years, every year.
And what about malnutrition? Because obviously that's still an enormous problem worldwide. How is UNICEF combating malnutrition?
A very, very important issue. Malnutrition is a contributing cause to 1/3 of under 5 mortality. What does that mean, a contributing cause? It really means that if you have malaria and you're also malnourished, you're more likely to die of malaria. And so it is a very important part of child nutrition. Now, let me just say that I think this is an issue that hasn't gotten enough attention in the world. And UNICEF is putting a lot of focus on this issue, particularly with last year's increase in food prices, this year's economic crisis, to make sure that the nutrition of the children does not suffer. Now, one of the things that we're clear to say is that food security does not necessarily mean nutrition security. Is that child getting adequate nutrition to ensure development, not be a stunted child? We know that if a child under the age of 2 does not get adequate nutrition in his or her first 2 years of life, and this actually begins in the womb, so 2+ years of life, then that child is more likely to have cognitive development diminish. That means the child is not going to be able to learn in school as easily or earn as an adult as easily, thereby perpetuating the cycle of poverty. So this nutrition issue, in my view, is one of the most important and one that we should be focusing a lot of attention on to make sure children not only get food, but they actually get the appropriate micronutrients in that food.
Now, since the food supply is vitally important worldwide, do you ever worry about bioterrorism and the food supply? And if so, what are the best ways then to protect the food supply?
Well, certainly when I was in the U.S. Department of Agriculture, we were doing a lot of planning for what kinds of attacks could be made on the food supply. You know, 9/11 happened, and every part of the government was looking at how can you best protect, you know, the part of the economy that you have some regulatory control over. And so the food supply, obviously in the U.S. Department of Agriculture, was critical. And there are attacks that could come against the food system in terms of food safety, in terms of animal diseases that would, you know, wipe out certain parts of our you know, production sectors in the U.S. And so these are issues that are of concern and that the world needs to pay attention to. I mean, the other things that have an overlap between animals and human health are the pandemic flu issues. We've seen the issue of bird flu. We've seen the issue of swine flu. So these issues of animal health and human health do have strong intersections that the world needs to pay attention to. And I think the UN has played a key leadership role in the issue of pandemic as well as in the issue of the food price increase and how to increase agriculture production as well as food and nutrition security.
And what about the role of the United States in that work, in whether it be pandemics, whether it's bioterrorism? Do you think that there's enough cooperation between the United States and other nations on that?
I think in these issues in particular, the U.S. has played a leading role, but also a key coordinating role with the international system. These are not issues that one country can deal with individually as countries. Diseases know no national boundaries or borders.
Right.
And so we must, as a global community, coordinate and cooperate. And I think the U.S. has, as I said, taken a real leadership role, but have been a key partner in the international efforts, which I think have been very well put together through the UN system.